I had a call with the Minister of Health of the Democratic Republic of the Congo, Minister Roger Kamba, concerning the new outbreak of Ebola disease in the country's northeastern Ituri province.
On May 15, 2026, the Ministry of Health of Democratic Republic of Congo confirmed an outbreak of Ebola disease in Ituri province in northeastern DRC. Consequently, the World Health Organization declared the outbreak a public health emergency of international concern. The Ministry of Health in DRC has reported that nearly 1,000 cases of Ebola have been confirmed and that more than 220 people have died of Ebola. In neighboring Uganda, health authorities have reported 7 confirmed cases linked to the outbreak, including 2 healthcare workers, as 1 person dies of the virus in the country. World Health Organization has warned that the outbreak is spreading geographically with the evidence of ongoing cross-border transmission. Following the increasing number of Ebola cases in the DRC, Uganda has announced a series of measures aimed at preventing the spread of the virus into Uganda. The government has suspended flights to and from the DRC, cross-border bus transport, and stopped all public transport between Uganda and the DRC except for cargo transportation. However, despite these measures, many people were still crossing into Uganda on foot, including students who study in Uganda but reside in neighboring Congo. This has led to the government announcing closure of Uganda DRC border completely for a period of 4 weeks.
Uganda is temporarily closing the border with the Democratic Republic of Congo with immediate effect. If you have been there in DRC and you come to Uganda, you'll be required to undergo mandatory self-isolation for 21 days. But we shall do strict supervision of that isolation, and this applies in Kampala and also in all districts, especially the border districts where a lot of movements have been taking place.
In Kenya, the government through the Ministry of Health has said that it's carrying on a rigorous screening process at the points of entry where 55,000 persons have been screened so far.
The outbreak for Ebola that is in DRC. As you note, we as Kenyans have a very strong healthcare response system. And when we say strong, we mean the measures that we have taken. So at the points of entry, we are doing rigorous screening. So far, we have screened 55,000 persons, amongst them 27,000 plus foreign nationals.
The government has also defended its cooperation with the USA government on setting up a quarantine facility in the country for American citizens from the DRC, a move which has faced backlash from experts.
And when we talk about case management, we mean hospital preparedness. We have the highest isolation capacity in the entire country, most of it that have also been built over COVID. But you also know that Kenya has been at the forefront of international response. In 2015, we are the country that was relied upon by the world to send 157 experts to help Sierra Leone contain and tackle Ebola from 2014 all the way to 2016.
Anton Dolo, Pmtv Kenya.